It's an honor for me to be asked to be on this advisory committee because the subject is near and dear to my heart, because not only have I always been very interested in women's health, I went into medicine so I could change someone's life in an impactful way. And, there's a lot of women are silently dealing with their own fears and their stress surrounding their fertility and their fertility being part of their identity. Or what happened to their mother when she passed from cancer. These are all very personal things, and it's really easy to feel out of control. But, if you're having like some sort of discussion or discourse on like how we can choose products or eat certain things or change our lifestyle to better improve our health and prevent certain things down the line for ourselves, it really not only makes my job easier, but it really makes me feel like a woman can empower herself to take charge of her own health.
And you were so relatable, knowing as your patient, just Kathleen really takes the time and she genuinely cares. And I always left your office feeling hopeful, thinking that there are simple things I could do to have a better life.
Oh, well, yeah, I think, I've been through everything you could possibly go through as a woman, believe it or not. I really think that I saw you. I remember you came in, and nobody knows anyone's journey in that 5 minutes. You just have to kind of guess. But I know when you came in, you went through it. And here you are using a surrogate. That is hard. I know what happened before then. And a lot of women are coming in anxious, and you can't share certain things like that with your husband and maybe even your friends because you feel like they're going to judge you. It's okay to be your true self at my office, and that's okay, and it's okay to express anger and be ugly and all of those things, and not feel guilty about it.
Yeah, and you make it a safe space. You're so relatable, and you genuinely care. We chose you, and we're so honored you're on our board because you genuinely really want to help people, and you're actively making a difference.
Well, I'm glad. I'm really proud of you because this is, you've turned this thing that happened in your life, this very stressful, hard, difficult thing, into something that will hopefully help other women.
So you have this very impressive resume. You've had an incredibly successful career. I would love to know what's been the most rewarding part for you.
So, when I decided to go into medicine, like every other doctor, I just wanted to help people. But I think for me, working with women one-on-one like I do, it gives me a chance to meaningfully impact someone's life. When they come in with a problem, to be able to take that problem and give them, some sort of a treatment plan that they can understand, which will also help them understand and teach them about their own bodies and how it's supposed to work, and give them all of the choices that are out. Instead of speaking down to them, how can we together come up with some sort of a solution to their problem, and have them walk out of my office feeling a little bit more empowered and knowledgeable about what's going on with their own bodies instead of living in fear. So I think being able to do that every day has been what keeps me going. I never get tired of it. The other thing is delivering babies. I think that, being that first person to touch a life is like a privilege. It's definitely a privilege for me, and it isn't about me. It's about this new person coming into this world and what this person is going to mean to the family I hand them to. So, I'm going to start crying. But it definitely, that is, it fulfills me in a way that I never even expected it to. I didn't go into this to deliver babies. I actually went into it to treat women like my sisters and my mom, So all of those things have been, the reason I keep doing. I don't get tired of it. I still get excited to go to work every day and, help a woman deliver a baby.
Dr. Valenton, thank you so much for your time. We greatly appreciate your insight and your wisdom, and you have very valuable time, and we really appreciate you and all your work.
It's my absolute pleasure to take care of you, your family, and help the women that you want to help going forward.
You're doing it.